Here's a typical intensive care unit today. Assuming that an average of 5 litres of intravenous solution are administered per patient, nearly 190 million litres of intravenous fluid are administered annually in the United States alone. You see, infusions are standard medical procedures, yet most people are unaware of their dynamic history and development. Let's take a little trip into the past. It all began in the late Middle Ages. In 1492, Pope Innocent VIII received the first historically documented transfusion. His physician decided to give him an infusion of blood from 3 healthy young boys, a daring and fatal undertaking. But progress was inevitable. The first working intravenous infusion devices appeared in England in the 17th century. Back then they were made of natural materials such as pig bladders and quills, not metal and plastic like today. Richard Lower is considered the father of IV therapy. His designs and new devices for transfusions can even be found today in modern syringes, needles, and IV catheters. Necessity is the mother of invention. The cholera epidemics that raged during the 19th century gave rise to significant milestones in the development of infusion solutions. Back then, Dr. William Brooke O'Shaughnessy came up with the first saline solution and succeeded in saving many lives thanks to IV infusions. Furthermore, the first warnings were issued about the dangers of air and particles in infusion solutions. James Macintosh from Edinburgh therefore recommended filtering infusion solutions at least twice using thick leather. Gradually, increasingly thinner needles emerged, and syringes were fashioned from glass and silver or metal. The early 1960s then saw a massive introduction of plastic syringes and disposable needles to the American and European markets. And the Massachusetts General Hospital of Boston was the first to allow a nurse, Ada Plumer, to administer IV therapy. After that, it became common for nurses to perform infusions, thereby elevating their importance in the medical field. Around the 1970s and 80s, IV infusions led to a wider and, in this case, social revolution, with nursing societies setting guidelines for its practice. Today, new and improved technologies are continuing to transform therapy options. Electronic infusion devices, drop counters, alarms, as well as safety features that protect against needle stick injuries and blood exposure. After 500 years, the focus is now on the safety of infusion procedures. And this is where Paul comes in. Over the past 4 decades, Paul has been developing multi-barrier filter concepts for the ICU ward. Paul infusion filters protect patients from infusion-associated health risks such as air and large particles, bacteria, endotoxins. Revolutionary changes have taken place since the late Middle Ages, and so far there is no end in sight. And how Paul filter technologies can protect the intensive care unit patient.